Okay.
How did it all begin? Well, it's an interesting story. Several decades ago, I started work in the slums, and being an OBG specialist, I would do free consultation, free operations, but even then, some money would be needed to pay for the hospital bed and to buy antibiotics, IV fluids, etc. And my colleague Sandeep Ahuja developed a network of people to buy all this for the poor. Very soon we realized that we could work in one public health problem of India where the need is tremendous and where we can leverage our efforts and our money to great advantage. We decided on tuberculosis. Firstly, we realized that one-fourth of the world's TB patients are in India. Not only that, we found that TB being one of the UN Millennium Development Goals, a lot of international agencies and the government of India are focused on TB. So medicines are for free, the diagnostics are for free, the public hospitals are aplenty, which can help us leverage the dollar 5 times over. This is how we got into TB. We also realized we could have a fully self-sustaining model with a government grant. And we realized we will be fulfilling a need, we will be educating the communities, we will be able to destigmatize TB, all at a minimal cost. And that is how we started work in Operation ASHA in TB. Coming to the history of the organization, I have already mentioned that I am a surgeon and OBG specialist. My colleague Sandeep Ahuja resigned from his job as additional commissioner in the government of India to work full-time for Operation ASHA. Initially, we started work with OBG. 2006, we opened our first TB treatment center. This was in Tehkhand, a rag pickers colony. Now, even amongst the poor, there is a hierarchy. The rag pickers are the lowest in the hierarchy of slum dwellers because they live surrounded by garbage, which is their raw material. That is where we opened our first center. There was terrible poverty, terrible amount of malnutrition, vitamin A deficiency, vitamin D deficiency, anemia, protein calorie malnutrition. All these things sap an individual's strength and make him prone to TB. That is where we started work. We ran our first center for, 6 months or a little more than that, trying to establish best practices. What should be the distance from the patient's house? What time should the center be open? And so on and so forth. And then we scaled up in a very big way. In the last 4 years,